What is Tourette syndrome drive? Tourette syndrome is a neurological condition characterized by involuntary, repetitive movements and vocalizations called tics. These tics can manifest as sudden twitches, movements, or sounds varying in frequency and intensity among individuals. Drive requires precise control and sustained attention, which sometimes raises concerns about the ability of individuals with Tourette's to operate a vehicle safely. This article explores the factors determining whether someone with Tourette syndrome can drive, addressing legal aspects, potential challenges and available support, eligibility and legal framework. Tourette syndrome does not automatically disqualify an individual from driving. The legal framework for driving privileges typically focuses on a person's functional ability to operate a vehicle safely, rather than a specific medical diagnosis. Many jurisdictions worldwide do not have blanket bans against individuals with Tourette syndrome holding a driver's license. For instance, in the United Kingdom, individuals are encouraged to inform the driver and vehicle licensing agency if their condition affects their driving ability, but disclosure is not mandatory if tics do not pose a safety risk. Licensing authorities prioritize whether tics or associated conditions impair critical driving skills such as coordination, reaction time, and attention. Some countries, like Sweden, or regions such as Northern Ireland, encourage or require reporting the diagnosis to licensing authorities if tics interfere with driving. This allows for a review to determine if any restrictions or conditions are necessary to ensure public safety. Impact of tics on driving ability. Motor and vocal tics can potentially affect driving, though the impact varies significantly depending on their severity, frequency, and type. Motor tics, which involve sudden, uncontrollable movements, might interfere with maintaining vehicle control. Examples include head jerking that could momentarily obstruct vision, or arm and leg tics that might disrupt steering or pedal operation. Vocal tics, such as grunting, throat clearing, or involuntary utterances, can also pose challenges by distracting the driver or causing a momentary lapse in focus. While some individuals may experience tics that worsen during driving, others report that their tics remain unchanged or can even be suppressed due to the concentration required for the task. A significant majority of individuals with Tourette's report that their tics interfere minimally or not at all with driving. Many people with Tourette's also experience co-occurring conditions like attention deficit hyperactivity disorder, anxiety, or obsessive compulsive disorder, which can also influence driving ability by affecting attention, impulsivity, or reaction times. Strategies and support for drivers with Tourette's. Individuals with Tourette syndrome can employ several strategies to manage their tics and enhance driving safety. Medical management, including medication, can help reduce the severity of disruptive tics. Pharmacological treatments may involve medications that affect brain chemicals or those used for co-occurring conditions. Potential side effects of medication, such as drowsiness, should be considered as they could affect driving. Behavioral therapies, such as comprehensive behavioral intervention for tics, offer strategies including habit reversal training and relaxation techniques to help individuals gain more control over their tics. Some drivers find that focusing on the act of driving can naturally suppress tics, creating a low-stress driving environment. Minimizing distractions and taking breaks during longer trips can also be beneficial. Adaptive driving techniques or assistive technology like lane keeping assistance or adaptive cruise control can provide additional support. Professional driving evaluations by certified driver rehabilitation specialists can offer personalized guidance and assess specific needs. The assessment and licensing process.
The process for obtaining or maintaining a driver's license for individuals with Tourette syndrome typically involves an assessment of their functional driving capacity. Licensing authorities may require medical reports from treating physicians or neurologists to understand the nature and impact of the tics. In some cases, a neuropsychological evaluation might be required, especially if co-occurring conditions like ADHD are present.